Gloves, but in
Okay.
real life, wear gloves, do
All right.
your sterile prep, okay? And so what you wanna do, when you are ready, is you want to hold the penis out on stretch, usually kind of like this. And what it means is, you're not stretching the penis to the point of pain, but you are holding it at an angle, usually kind of closer to a 90-degree angle. And then you are gonna be injecting that lube directly into the urethra, okay? You can inject all of it. I usually inject like 3/4 of the syringe and leave a little in case I need it. Okay, and then when you're ready to place your coude catheter, remember that the curved tip needs to be pointed upwards for it to be able to do its job. And then you want to go ahead and advance the catheter.
So you really are like almost perpendicular to the body in a way with the top.
Yeah,
It's pretty pointed up.
yeah, it's pretty close. You kind of get a feel for it. But what you don't want to do is you don't want to do this.
Okay.
That's not helpful. You will not be doing yourself any favors. Okay, I skimmed on lube. Learn from my mistake.
It's getting dry.
I know. And it's turning a little bit.
Oh, there it is in the
Here we
bladder.
are. And then
Yay.
again, remember you want to make sure to hub. Normally your catheter will not be going outside the bladder. But I'm gonna hub just for good practice.
Yep, all the way to where it bifurcates.
Yep. And
There
then
we go.
here's the point at which if there's no return of urine, push fluid in, draw it back, okay, to confirm that you are intraluminal, and then go ahead, don't use the lube syringe, use the saline syringe, and inflate the balloon. And then you pull it out and then hook it up so that it's secured.
Pull it out like you push it against, so if
You kind of pull it out so that when you've inflated the balloon, you kind of want it to rest where it's anchored, and then that way you have a little bit more leeway to hook it up, and it's not all the way into the bladder.
okay.
Okay.
That's the female.
And then with the female, similarly, you put some lubrication in. Okay, you want to make sure you have good exposure. Fortunately, we have very good exposure. You want to make sure you don't go too high, catheterize the clitoris, or too low, and try to catheterize the vagina. Okay, go ahead and put the catheter in. Okay.
And that one's the one you don't have to go as far.
You don't have to go as far, but it's also,
You don't want it dangling out either very much.
yeah,
right?
it's also fine to hub the catheter. I think it's better to be safe and to hub than not to. But yeah, because the urethra is so short, you should not need to go all the way in. It's just that you would want to make sure before inflating the balloon that you're confirming that you're in the right space by flushing fluid in and drawing it back and making sure that both of those feel easy.
Okay.
Okay, and then the technique that I had mentioned before, if you have a difficult Foley and you're not able to get the catheter in, or it's keeps slipping into the vagina, you want to put a finger in to occlude the vaginal canal. And then this works a little better when you have a recessed urethra, because a lot of times the recessed urethra is kind of along that wall, that upper wall. But you'll go ahead and I'm all lubed, sorry. You'll go ahead and then slide it in, and then it slips into the right place, okay? But in this one, it's a nice straight shot, so it's a little bit different. But that's the technique that we're talking about, using one finger, usually your non-dominant hand, to occlude the vaginal canal and serve as a guide to get the coude catheter to slide into the right place.
Awesome.
that's
Alrighty. Thank you.